My name is Alex Muir. I'm 22. I'm from Aberdeen, currently working at the University of Dundee. The title of my talk is Transforming Transport and Healthcare Through Active Activism. The aim of this talk is to try and open up people's minds and have a bit more of a discussion about the current state of trans healthcare and the different ways that we are currently approaching it and looking at ways that we can improve it from a non-medical perspective. Over the last year, I've been working on a project that's based in the University of Dundee called the Transports Initiative, or TSI. This is based on some of the research and work I was doing around trans healthcare, mostly based on the problem that the average trans person in Scotland will have to wait about 12 months from seeing their GP to seeing an actual gender specialist and getting the help and advice they need in that area. This is something that I found to be a major problem in the trans community because that sort of 12 months or missing year is one where people are at really high risk of things like gender dysphoria, anxiety and depression, and therefore the other sort of unfortunate situations that come about through that. The aim of the project is to help people find a way of dealing with these different issues in a non-medical perspective that is more accessible and means they're not just waiting around for 12 months to try and get these hormones. They're actively doing something about it that can improve their own mental health. The aim of the project is essentially reclaiming bodily autonomy through sports. Through this project and through this talk, I hope to get people more informed about the situation in trans healthcare, but also the situation in trans sport, how these two things can be combined to actually work together to improve trans healthcare and actually healthcare overall potentially. It'll be a bit of more information about what's been going on in Dundee and hopefully engage a discussion and get a bit more engagement in the different ways that people and healthcare professionals can actually engage in the system and help people overall. The second part of the talk is more focused on the trans sports side, giving more people information about the different barriers that trans people face in sports, from your basics of transphobia and discrimination to things such as the issues around changing rooms, legality around contact sports, and even training in a binder. Bring people more information about this and hopefully bring a bit more awareness and help more people get back in sport and improve people's lives overall. I hope you accept my talk. Sorry a little bit for the video quality, and hopefully we'll hear from you soon. Thank you.